Malaria is a life-threatening disease caused by parasites that are transmitted to people through bites of infected female Anopheles mosquitoes. It is preventable and curable. In 2020, there were an estimated 241 million cases of malaria worldwide, and the estimated number of malaria deaths stood at 627,000 in 2020. The World Health Organization states that African region carries a disproportionately high share of the global malaria burden. In 2020, the region was the home to 95% of malaria cases and 96% of malaria deaths. Children under 5 accounted for about 80% of all malaria deaths in the region.
Malaria cases were 11.3 million in 2021. However, this year, 2022, 14.3 million people have already got malaria. In 2021, a total of 2,773 people died of malaria. As of October 2022, a total of 2,489 have already died. So the people who are dying from malaria are almost as many as the ones who died from corona.
It's at about number 8 in terms of mortality. And in terms of disease burden, we are number 3. I think Nigeria is number 1. But if you compare the ratios, population to case ratio, then ideally we should be number 1 because Nigeria has a much bigger population than Uganda. I think they are probably over 100 million. And we are 44 million people, but 12 cases. That means that's about between a third and a quarter of the population gets malaria.
In Uganda, overall malaria deaths reduced from 45,764 in 2000 to 21,699 in 2020. However, there has been resurgency in the past 5 years, with the cases increasing from 16,198 in 2015 to 21,699 in 2020. Children and pregnant women are at the high risk.
There was the spraying of walls. What happened to that? You tell us, Jane.
Your Excellency, indoor residual spraying is still ongoing in eastern Uganda and northern Uganda. However, there is a challenge that the current chemicals that we are using, the mosquitoes became resistant to them. So we have ordered other chemicals to use, and we still continue to spray.
There is an urgent need for new partners in the fight against malaria, which continues to affect millions of people in Africa. Despite decades of progress, it remains one of the continent's deadliest diseases. Malaria has an overwhelming toll on economic productivity, business cost, and human capital development, making it a top priority for the government of Uganda.
Particular study that's going on, and that is what we call gene drive. Gene drive means we are trying to target at eradicating the mosquito because we all know that malaria is spread by the female Anopheles mosquito. Now, gene drive means you're manipulating the genes of the female Anopheles mosquito so that we have more males in population as you weed out the female. Because malaria is spread by the female Anopheles mosquito, not the male Anopheles mosquito. So that is being tried out in Malawi, in Uganda, in Tanzania, and in, I think, Burkina Faso as well. It's still at the trial stage. Preliminary results seem promising, but we think that we shall be able to fully launch it by around 2030. So,
for application for Uganda, the first grant, we have put the expression of interest. We are expected to give the final application to Gavi by January. So we are in time. All drafts are made. It is undergoing consultations and approvals. But we shall be implementing this vaccination not as malaria program, but as a sector utilizing the immunization program. It is fitting in the UNEP program. It will be the 13th vaccine on the routine immunization.
Did well on the parameters, having commitment from the president, having commitment from members of parliament, but the gap now is translating it to the district, and thank God for parish development model, strategic pillar 4, where we have social services sector. So health is there. We will not only address malaria, but we'll be addressing the issue of health resilience in Uganda.
Unfortunately, malaria attracts limited attention and funding has stagnated in the recent years. The World Health Organization estimates that an extra 10 billion is needed to implement national strategic plans for malaria control in 30 African countries over the next 3 years, again underscoring the importance of private sector engagement.
The biggest chunk of our malaria budget is donor funded. I think of the $150 million that are needed for the management of malaria, I think 90% is donor funded, both for the medication, the laboratory consumables. We're talking about the rapid diagnostic kits.
So finance and the PSSD, we discuss issues of financing for malaria. If you say you're putting over 1 trillion in parish development model, but people are dying, because parish development model is targeting the poor, 39%. But those are the same people malaria is targeting. Malaria is not targeting Tayewa. No. I can, even this you're spraying, I can afford it myself. So whereas we are targeting, uplifting people out of poverty, you can only uplift people who are healthy.
This year, Uganda experienced an epidemic of malaria in selected regions across the country. The increased cases were reported in the selected districts of Bukedia, Busoga, Lango, Acholi, Toro, and Westline regions for the period of 8 months. The most affected districts were Namutumba, Kibuku, Butaleja, Budaka, Butebo, Bujiri, Bugweri, Buyende, Iganga, Jinja City, Palisa, Kaliro, Kamuli, Luka, Mayuge, Namayingo, and Tororo. Others include Ankole, Toro, and Kigezi, with a test positivity rate of over 30%. The Ministry of Health developed and disseminated a national response plan to curb the increased number of cases and mortalities in the affected districts. It disbursed a total of 1.2 billion to 55 districts to support case management and surveillance. The World Health Organization is also concerned about more recent reports of drug-resistant malaria in Africa. Regular monitoring of drug efficacy is needed to inform treatment policies in malaria epidemic countries and to ensure early detection of and response to drug resistance.
Now we have already some emerging evidences, early evidence that there are actually signs of drug resistance to the artemisinin combination therapy. So there is a very strong surveillance going on by the National Malaria Program, as I learned, already recognizing that like 3 countries have already reported and demonstrated that there is already going on, evolving drug resistance. So there is need to be a very strong fight against this resistance as well.
Zahra Abigaba, UBC News.